That's the real power of advertising right there, where you can improve key societal things. That's what inspires me to do this work.
Moving someone from awareness to care is a much more connected journey than it's been ever before. You can't show someone an ad and immediately think that they're gonna take action. You really need to create that awareness at that pre-awareness, the audigent level, at the patient level. What's gonna take them from that awareness to care is gonna be many factors. It's gonna be access to the prescription. It's gonna be emotional factors.
Being able to cut through that is extremely important to moving somebody down that chain. There's also an aspect of it that has to do, I think, with sequencing that is important. And again, that's where something like a very consistent data spine is important, because you have to be able to activate, get a quick readout, an accurate quick readout, in order to understand what just occurred in the journey, in order to send the next most important message. And again, as you navigate this ecosystem, if you have to retranslate data, identity layer data, that takes time.
Our HCP and consumer strategies are still very siloed from our perspective. Many brands still have completely different teams that are, planning and running these campaigns. The strategies feel different, but they're not actually different. In real life, these two, what matters the most is when a patient comes into a doctor. We're really hoping to kind of help bridge the gap between those two things.
You also have these very unique inventory components like endemic media that only exists in a doctor's office or in a hospital or a point of care environment, for example. So timing all of these things to reach the audience at the right time, whether you're brand building or right at that point of care moment as well, are incredibly important. So the orchestration of all of that is what DeepIntent does for brands and agencies, and partners like Experian are key to that process as well. So the more that we can help bring relevance and precision to everything they do, the better chance they have of bringing that product to market successfully. In order to do that, the more relevance you can bring to the process, the more chance they have of being successful. And if you can unlock that value, we have the potential to bring more treatments to market, because the ones that often get left behind are often those with a smaller potential population to reach. If we can help commercialize those treatments, we can bring more treatments to market that might affect smaller populations, but we might end up saving people's lives or extending people's lives in really meaningful ways. And that's the real power of advertising right there, where you can improve key societal things like that. That's what inspires me to do this work.
We really need to be mindful of how we're targeting and how we're using that targeting. Bigger audiences not always better, but smaller audiences not always better. So really finding the niche of, what is going to be the sweet spot for who you want to target. You're getting, again, those vanity metrics back. So how can you tie that back to actual patient outcomes? I think that's really important as well.
Oftentimes, most healthcare marketers just need some form of data bridging to get things done quickly in order to start to tie data sets together. I think there's definitely a need for a clean room overall if you're going to do like a broad measurement study, but a lot of it can be handled with like a trusted third party doing some data bridging. I passionately feel that this is the most important thing, is that we create better conversations between patients and doctors. So when somebody's struggling with something, they have a lot of questions, there's a lot of anxiety that rises up. Being able to give them some information so that they can go have that conversation with the doctor, and having the doctor be equally informed in that moment so they can talk about it, I think ultimately leads to better diagnosis, conversation, treatment, and ultimately bettering patient outcomes, which is what we're all about.